Greetings, everyone, to this awareness presentation on immunizations. For those of you who don't know me, my name is Suzanne Pichet, and I'm a Canadian nurse with 32 years experience in community health prior to this, and 20 years of military nursing experience in various positions and deployments. My specialty is in mental health, but now I'm semi-retired. I live in Denmark, and I occasionally work contracts for Canadians wherever I'm needed and in whatever role I'm needed in. So today we're going to be talking about the World Health Organization Awareness Week in Canada, North, South America, and Europe. That last week of April is dedicated to awareness of immunizations. This week has been initiated since the early 90s to raise awareness of the importance of immunizations for people's health and well-being. In 2018, the campaign will focus on immunization as an individual right and shared responsibility to help close the immunization gaps and further progress towards global sustainable development. Today, I'll give you information and ask you questions to raise your awareness of the importance of immunizations, their history, their significance versus vaccine hesitancy, and how we can all work towards development goals, what we can do as individuals, resources that you have available to you. First, let's start off with a brief history. Okay, first of all, we know of the Chinese who discovered that when they had healthy people exposed to smallpox scab tissue, they were less likely to get infected with the disease later on. Or if they did, it was a much milder, less dangerous version. So they would crush the smallpox scabs into powder and then blow it into the nose. Then much later, 1721, England uses a vein opening technique. And it's based on the same premise that the vein was opened and powdered smallpox from scabs was applied. And smallpox inoculation was still dangerous. It still killed about 2 to 3% of those injected with the small amounts of the virus. So in 1796, Edward Jenner discovers a safer way of inoculating. He took pus from a person who was infected with a similar infection, cowpox, and then he rubbed it into the scratched arm of an 8-year-old boy, and the boy never caught smallpox. This was a much safer version. In 1880, Louis Pasteur discovers a way to inoculate. What he does is he takes fowl cholera and anthrax, and usually he would introduce these bacteria to animals, and they would die. But by accident, he left the cultures of bacteria lying around. The bacteria were weakened or dead, and he exposed those weakened and dead viruses and bacteria to the chickens, and they didn't die from the disease like they'd had before. So they were protected from it when he injected the live bacteria later. So Pasteur publicly demonstrated this by inoculating one group of farm animals against anthrax while leaving another group of animals unvaccinated. After several weeks, he exposed them all to anthrax bacilli. All of the vaccinated animals survived. The unvaccinated ones did not. Later, he developed a rabies vaccine using the exact same techniques. So in the 20s, more vaccines are developed. Diphtheria, tetanus, pertussis, tuberculosis, all become widely available. So let's start with a few questions. Pertussis is another name for which of the following diseases? Hand, foot, and mouth, fifth disease, rotavirus, whooping cough. Whooping cough. If you said whooping cough, you're absolutely right. It's also, it's known as whooping cough because of the sound that people make when they're gasping for air after a fit of coughing. Coughing fits due to pertussis infection can last for up to 10 weeks or more. This disease is sometimes known as the 100-day cough. Next question, did research in Canada lead to the development of the polio vaccine? True or false? Well, that's true. In 1952, a team of researchers at the University of Toronto worked with Dr. Jonas Salk from the University of Pittsburgh to develop the Salk vaccine for polio. In the 1960s and 70s, vaccines for meningococcal and pneumococcus are developed. 1980, smallpox is eradicated from the globe. This is considered a landmark for medicine. 1994, polio is declared eliminated from the Americas. In 1998, Andrew Wakefield, a British researcher, publishes research stating the MMR virus vaccine is linked with autism spectrum disorders, and the anti-vax movement begins. Some of you may have heard of this. The anti-vax campaign remains an issue today. How many lives does immunization save every year? 2.5 million. Immunization is one of the most successful and cost-effective health interventions, and it prevents between 2 and 3 million deaths every single year. 2002, polio is eliminated from Europe. Today, only Pakistan and Afghanistan continue to have polio cases. So just take a moment to look at the figures on this chart. Common childhood diseases are reduced by over 90%, and polio and diphtheria completely eliminated. Intentionally unvaccinated kids and adults pose a risk to others, especially to those too young to be vaccinated, those with immune system problems, or those who can't be vaccinated. And the intentionally unvaccinated kids and adults are responsible for starting most of the outbreaks that we continue to see today, including a recent measles outbreaks that are costing millions of dollars to contain. 2006, the first HPV vaccine is developed. What vaccine other than the HPV, the human papillomavirus vaccine, prevents a form of cancer? Hep B, rotavirus, Hep A, or influenza? It's Hep B. We all know that HPV vaccine helps prevent cervical and other cancers, but the hepatitis B vaccine also prevents cancer. Liver cancer can form as a result of hepatitis B. By getting vaccinated properly, you can prevent not just one, but a number of different forms of cancer. Nowadays, there are over 20 vaccines currently in use for vaccine-preventable diseases. This is a current list of those diseases, with many new or improved vaccines and technologies coming in the future in the research pipeline. Vaccines for HIV, Ebola, Zika, malaria, gonorrhea, etc. are all being explored at the moment. And new delivery systems, from tablets, not just needles, but tablets, liquid drinks, and nasal sprays, to timed release implants and nanoparticles are being developed so that widespread immunization is possible for all age groups. 2014, measles is on the rise. This is our more recent history. The CDC reports the highest number of measles cases in the U.S. since measles was declared eliminated in 2000. In Europe, 21,000 cases were reported. In Canada, only 45 cases, but this is still 4 times the number of the year before that. Anti-vaxxer sentiment has increased in recent years, contributing to the parallel drop in vaccination rates. And indeed, anti-vaccination beliefs were always around. Hundreds of years ago, before we knew inoculation was, whether it was safe or dangerous. But now studies have repeatedly shown that vaccines do not cause autism, and they are completely safe. How many annual cases of measles in Canada? were there before vaccines were introduced. So before the mumps, measles, rubella vaccine was brought into our system. 60,000. There were approximately 61,370 cases of measles a year before the MMR vaccine was available to Canadians. Since the vaccine was introduced, there has been a 99% decrease in measles cases. And MMR stands for mumps, measles, rubella. True. What is a natural infection? A mild disease, a cut or a scrape, an infection you get only in childhood, a disease caused by a germ found in the environment. It's a disease or infection caused by bacteria or viruses found in the environment. Examples are measles, chickenpox, etc. What are 2 ways to get immunity from a disease? By staying away from germs, eating healthy food, by getting enough exercise and sleep, by natural infection and by vaccines, by keeping houses and schools very clean. Okay, this is totally wrong. Ignore this slide. The actual answer is by natural infection and by vaccine. I'm not sure how that slipped by me in my presentation. My apologies. There are 2 ways to get immunity, by natural infection and by vaccine, and both produce the same results. There are 2 paths that you take to the same goal. However, other vaccines may protect you, but they don't actually, they may not be able to protect you completely. So that's why we say that you may have to have booster vaccines. And I just wanted to try and correct that, but I'm not going to be able to. It'll just slow things down in the presentation. Immunization records must always be kept at a doctor's office. That is false. Everyone is encouraged to record and store vaccination information for themselves and their families. To make this easier, you can download a free app that allows Canadians to keep track of their vaccinations, access vaccination schedules, manage vaccination appointments for the whole family, and much more. For more information, just visit Immunize Canada website, and I'll give you that link later. Most Canadians and adults are up to date with their immunizations. That's false. Sadly, the recent Adult National Immunization Survey has found that while 87% of Canadian adults believe they are up to date with their immunizations, less than 10% actually received all the recommended vaccines according to their age and the presence or not of chronic medical conditions. So these are some websites to check out. First of all, the one that was just mentioned, Canada.ca, and this is the link. And it's a Canadian federal government website. It's bilingual. It has multiple resource material, and it also has that app that I just mentioned previously for you, which is very handy. The other website that I would recommend is a BC Public Health Association website in support of UNICEF. And the iBoost Immunity website actually allows you to go in. You have to create an account in order to do this, but you answer questions very similar to the questions that we've just gone through in this presentation. In fact, some of them may be the same. And if you get a question correct, then they will donate a vaccine to somebody in the world who needs it. So you can actually raise vaccines for other people, which is kind of a nice little thing. There's also lots of information on that website as well. The only drawback with this website is that although the questions for the quizzes are bilingual, the video presentations and the documents are not. They're in English. So your other resources and your very most important resource is the Canadian Medical Clinic in Guylinkirchen. So here's the main number that I'm giving you, And what you want to do is speak to the community health nurse. And what I always recommend is going through the front desk, because you never know, that community health nurse may be in with somebody, or they may be out doing immunizations elsewhere or on a different tasking. So it's very important to call the front desk, and they will make sure that you get hooked up with the community health nurse. And even if you're just traveling somewhere, or you have questions about your immunization schedule for children or yourself, that is your #1 link. Immunize.ca, that's another website that you can go to. And the Can Immunize app, I know it works on the iPhone, but I'm not sure about Android. It's not really clear when you download the app whether it works. And I personally use an iPhone, so I can tell you it does for sure work on iPhone, but I'm not sure about Android. And it is very handy to have because you have it all the time. If you are not close to the GK Medical Clinic, wherever you are, there is always a local travel or public health agency, or you can always phone one that's close to you and get information within your own environment or country as it stands. So those are your resources, and you can always take a look at this again after you're done in order to get them. My resources that I've used in case you're interested. And if there's any questions or follow-up with regards to this presentation, please don't hesitate to contact me. This is my contact information. Thank you so much for joining me on this immunization awareness presentation, and I appreciate your attention. Thank you.